program. Now, can I request Dr. NASRIN to give her message?
Respected IAS President Mr. Y.A. Rahim and other distinguished guests on dais, and my dear children and parents who have assembled here, a very good evening to everybody. The job assigned to me on this very auspicious day is to highlight certain points about autism from the medical point of view. So as many of the parents I know that here who have assembled are well versed with this autism topic. But still I would like to highlight to those who have not been much in contact with this particular problem. Autism is a neurodevelopmental disorder. Actually, it is affecting the brain and it causes some impairment in the social interaction, in the communication and language functions, which is associated with a repetitive, a stereotyped and much restricted behaviors. This is the actual definition of autism. Autism comes under a group of disorders which is called autism spectrum disorders. Autism spectrum disorders have actually 5 categories and they have some similarity in the symptoms or in the manifestations, but in severity it varies. It can be a mild to very severe form. So mainly these disorders are basically, one is autism, one is Asperger's, and one is childhood disintegrative disorder, Rett syndrome and PDD, not otherwise specified. So let us talk about autism today. So what's happening in autism? In this disorder, the 3 major areas of development of children are affected. What do you mean by the development of children? The development of children means it is the acquisition of many functions, many skills, which starts from the uterus and it continues, the process continues after birth until the child it reaches the adult, the child reaches adult stage, that's around 21 years of old. So during all these years, the process of development is going on, and that is the acquisition of new skills and functions. So what is happening in autism is the 3 major areas are affected. One is the social interaction skill. They cannot socially interact as expected from the society. Second one, it is language and communication. That is a language and communication, both in verbal communication, that means using speech, and another one is non-language or non-verbal communication, that is using your certain gestures, your hand movements, your body movements, etc. Of course, certain acquisition of certain certain activities like age appropriate development of the behavior skills and their activities, their interests are also lacking. So these areas are affected. Over the last 15 years, the incidence of autism has been increasing according to the statistics. But actually there is a much controversy about this. This is a really, is it the number of cases are increasing, or is it due to the recognition of autism or awareness of autism has been is due to an increase, and so you are able to diagnose more number of cases in a day-to-day basis. So it could be due to that. That's previously we should have missed many cases. So, and almost if you take the incidence, means 1 in 68 born babies are affected by autism. So this is a new survey conducted by the Center for Disease Control, and this much effect is 4 times more common in boys than in girls, and there is no social boundaries, there is no actually social boundaries or ethnic boundaries or racial boundaries for this particular disorder, and the educational levels of parents, your lifestyle, or your financial status, or nothing is affecting this, a child is having a chance of being autistic. So what is the cause of autism? The cause of autism is exactly no cause has been found out so far. So what's happening in autism? Once it was wrongly believed as a mental disorder or a child psychiatric disorder, but not that concept is changed. And it is now these individuals or children are taken as a specially abled children or differently abled children. So that what's happening in the brain, it is actually there are certain changes taking place during the brain development, definite structural changes as well as functional changes. The certain areas of the brain which is controlling your emotions, your language function, your social functions, they all are undergoing many changes. It has been founded by many studies conducted recently, and of course there is a functional unit of the brain. It is not processing the information properly. That is why these children are not able to comprehend what you are talking to them or what you are expecting from them. And another thing that one of the new theories suggests that's a mirror neuron theory, mirror neuron. These neurons are some things which these neurons are especially special neurons in the brain. These neurons get stimulated by the action or by the scene you are seeing when you are either a small child or you are an adult. You are trying to imitate that particular action or that particular scene. So what's happening, suppose if a child sees a person having a coffee or having some other work, the child tries to imitate. This is a part of learning actually for these children. This is imitation or learning through that imitation is lacking in these children. And many of these, many autistic children, if you take, they have a family history of autism. Their first degree relatives are affected. You can see that, so that means it runs in families. It runs in families, so that makes the autism as a genetic disorder. That is, genes are playing a role in autism. So the genes from mother and father, usually that baby acquiring the genes from mother and father, these genes are undergoing certain changes or mutations, we call it as, and that is causing autism. And this is one of the genetic theory. And of course, there are certain environmental factors playing a role, how the baby is brought up, how the stimulation you are giving to the baby. And if you take the risk factors, basically the family history of there are few risk factors which plays not major role but a minor role in the causation or in the formation of autism. One is a family history, and if the age of mother and father, if the mother is at the time of pregnancy, if the mother is above 35 years old and father is above 40 years old, there is a chance, a high risk for the child. And the pregnant woman, during the pregnancy, if they are exposed to certain chemicals as well as certain drugs, like for example, if the pregnant woman is exposed to alcohol, if she is consuming alcohol or if she is consuming some epileptic medications, anti-epilepsy medications. And another thing, certain infections have been, during the pregnancy, have been attributed. That is, one of the infection is, we call it as rubella or German measles. And the the risk factor is the premature and very low birth weight babies. They have also a high risk. This places the baby at high risk for developing autism. But I would like to say here that a wrong concept that's going on now in the society, there is no scientifically associated, there is not scientifically proven, substantiated association between the MMR vaccine and autism disorder. That you please take it into mind that, and don't deny your children having the MMR vaccination. There are certain, there are certain characteristic features. Usually these children, exhibit this autism. Autism is not limited to the childhood or toddlers. The toddler and autistic children will go into the childhood, and an autism child will become an autism adolescent, and adolescent will go into an autism adult. So you can pick up at any stage there are certain behaviors these children or adult exhibit or they show, that from that you can pick up this autism, such a person is suffering from this problem. So there are peculiar type of behaviors. They are called basically these behaviors are coming into two categories. One is social communication interaction behavior, and second one is very restricted repetitive behaviors. So this in the social communication interaction behavior, you might have noted that the basic problem with them is having a constant eye contact while you are talking to them. So these adults are very reluctant to have a persistent eye contact, or they don't have any eye contact at all. They don't look at your face to look at directly into your eyes. And they are very emotional, they are very fragile persons. They get upset, they always want the sameness, the same routine or the same environment. So once it is broken or any change comes, they get upset, and they might manifest it or they might show it in the form of aggressive behavior, or which the society can't take it up. So you have to be careful about that. And they don't mind the people who are talking to them. They don't listen or they don't pay attention to the people, even if the other person is talking very next to him or her. And they want to be in a loneliness. They prefer a loneliness or in their own world. And when you call their names, they won't respond, or they take a long time or a repeated calling to look at you or to turn to you. So that is one of the very characteristic features. And another is that they lack the theory of mind. That means they cannot read your other person's feelings, like even if that other person expresses their anger, their distress, or even it is an affection or love, they cannot understand that person's feeling, and so their response will be totally, you feel it as an abnormal way, or it's an abnormal response, you can feel that. And there is another thing which is called joint attention. So if you try it, normally what do you mean by joint attention is that, like if you try to point, like it is a way of, or it is a ability to share the joy, or joy of seeing an object, seeing a scene or an activity with others. That means if you see something which is happening, like suppose if your elephant is walking, if you are pointing to that elephant and see that, look at that elephant. So any child, normal children will look at that elephant, they will share that joy of seeing the elephant. But here these poor children, they cannot look at that, they cannot enjoy that particular scene. This is called lack of joint attention. And they have this, even some autistic children, because of the training they acquire, as I said, they have a varying spectrum of, severity of their problem. Some of them are very mildly affected, some of them are very severely affected, they are totally insensitive. Mildly affected autism children, they are called high functional autistic children. They acquire some language function, they can acquire language function, but still to certain extent they will have difficulty in carrying out a conversation, or either initiating or carrying out the conversation. And they are particularly interested in certain objects, so talking about that particular object or particular topic is for hours they can talk. And another characteristic feature you might have observed is echolalia. We call it as echolalia. That means repeating the same phrases or words you are asking. If you are asking them, what's your name? They will answer you, what is your name? Or, so whatever you are asking, they will repeat it. This is called echolalia. This is a very characteristic feature of autism. And they sometimes use certain odd words which are totally out of place and which you couldn't understand the meaning, which you won't be able to understand the meaning. So this is the odd word they use. Like for example, once the child was giving a paper to a parent and he was asking like red adder. So the parent couldn't find, well, what is it, what does that mean? So finally they found out that he's asking to make a rocket with a red, like not only the rocket, the behind the part or the lower part has that red adder of a cow's appearance. So this is some of the like small example normally how the children uses these children uses some odd words in the place of some proper usage. So only parents can understand their conversation. And having these facial expressions, and they cannot, like their odd movements, their body movements, gestures are totally different from normal children. And another thing is a very important thing is a restricted repetitive behavior. They keep on doing some repetitive behavior like the flapping hand, finger movements, or spinning a toy or something. Like they are very much interested in this. Repetitively they can keep on doing this for hours, and their interest is maybe something very highly focused on certain objects. For example, I had a child who was very much interested in the spinning movement of a washing machine. It is a moving object, so he will spend hours and hours in front of that washing machine. So this is a and certain topics they will be interested too much, like numbers, sometimes music, and that peculiar character also there. And certain signs you can detect, especially as parents or as a normal persons who are mingling with the children. You should understand that during the first 3 years of life, these signs usually appear. So if you can detect these signs before the age of at least by 20 months or 24 months, at least before 30 months, you will be able to give a proper treatment for that children, and their outcome will be much better. So that's certain things, during the toddler stage or babies, you should know there are certain red flags of autism. Normally by 6 months you are expecting a child. When looking at a child, the child should look at you. That means eye contact. Especially with the mother, usually the child when the mother is feeding, the child will look at her eyes and appreciate and smiling. When you look at or you smile at the child should give a smile back. This is called a social smile, and the child should have a joyful expression. Normally by 6 months, autistic children, they don't exhibit these developmental milestones, and by 9 months if the child is not able to vocalize means I am not talking about some peculiar sounds with meaning, just sounds like cooing or gagging or some kind of sound. If the child is not able to make, that is also it should alert the parents as well as pediatrician. And it is by 12 months is very important for the outcome. If you think about the outcome, it is very important. And a diagnostic evaluation needs a multidisciplinary team which involves a pediatrician or a developmental pediatrician and a psychologist, and of course a pathologist, the speech and language pathologist, occupational therapist. They together they form this team, and they will diagnose this child as autism. Until that time, you are not supposed to label any child as an autistic child. And then we'll come to the management. The management of autism is basically, there are two categories. The main category of autism management is educational interventions. That is what Najma Center is doing. So educational intervention, you start the educational intervention for example, the speech therapy, the sensory stimulation therapy, or behavioral therapies, like ABA behavioral therapy, occupational therapy. You start the intervention as early as possible. And this should be like a good intervention program has certain features. There's one, it should be administered at least 25 hours in a week and 12 months in a year. That may definitely make a better outcome for your children. And the student to teacher ratio should kept minimum. If possible, it should be 1:1. And you should involve the parents you should train your parents first, and you should involve all the family members in this educational programs, and you should provide opportunity for these children to interact with the normally developing children as it's happening here. There's a normally developing the peer group, the same age to group, and it should be given by a good, well-trained therapist and teachers. And basically these programs should focus on because each child with autism is unique. Their demands or their needs are unique. So you should definitely address that particular need of the child and the core areas affected, and the progress of the child should be evaluated regularly. And like other therapy, other mode of therapy is medicines, but medicines play a very minor role only in certain symptomatic condition, like if the aggressive behavior or some sensory behavior, like a repetitive sensory behavior or a hyperactivity, you need certain medicine, but medicines play a very minor role in the therapy of autism. So this is what I want to stress, that like you begin the therapy as early as possible, at least before the age of 3 years, and so that will make a better outcome, that your child can, each child, the response will be different. It won't be the same, but definitely all children will benefit from the therapy. So, and you can incorporate these children by the aggressive therapy, aggressive interventions, and proper support for the family, the parents, and with the proper, you give a proper support to the family and parents, constant support, you can make these children incorporated or integrated into the mainstream of the society. Thank you.